I'm Dr. Saumya Mittal. I'm the consultant and head of the Department of Neurology at Shada Care Health City. And today we'll be talking about stroke. Now, what is stroke? Stroke is a very common neurological problem in which the blood vessels of the body are affected and of the brain are affected. In stroke, what really happens is that the blood vessels which are reaching the brain, they are affected. They either have a clot in them or they get ruptured. So when there's no blood supply to the brain, the part of the brain gets damaged, the neurons of the brain die, and one develops a stroke. Alternatively, sometimes the blood vessels can rupture, they hemorrhage, and the person can develop a brain hemorrhage. That is also a part of the stroke. Now, when these two things happen, whether it's a brain hemorrhage or it's an infarct, they always cause some symptoms. Commonly the hemiparesis, which is weakness of one side of the body. There's difficulty in speaking. Either one is not able to speak or not able to comprehend what is being spoken. And the third symptom is facial weakness. The eyes are broader on that affected side and the face might be drooping. So those are the most common symptoms of the stroke. Along with that, there can be other symptoms depending on what part of the brain has been affected by the stroke. So when all that happens, one has to think that he has a stroke and reach to a stroke-ready hospital immediately. When you reach the hospital first, there are specific medicines which can be given to you. When you can give these specific medicines during that limited time period of 3.5 hours to 8 hours, 3.5 hours specifically, the person can improve. Up to 8 hours, yes, can be sometimes done when we have got a possibility of doing a thrombectomy, which is like putting a stent in the artery. So these two mechanisms help us open up the blood vessel which is getting clotted and which is getting blocked, which stops the supply of the blood to the brain. So if you have had a stroke, do not think that then nothing more can be done. You have to take the couple of medicines so that you do not develop a second stroke. And with the rehabilitation, there's a good care, good possibility of you recovering at least to a functional level. So never get disheartened with once you have a stroke. Always there's hope. There's always something that can be done for you.